we'll be demonstrating cataract extraction using phaco emulsification. In this instance, we're utilizing the Alcon Legacy phaco emulsification machine. To start the process, the eye is anesthetized with drops, and the lids are supported with a lid speculum to allow the patient to relax and not worry about blinking during the process. A tiny incision is made in the periphery of the cornea, and this allows us to fill the eye with viscoelastic, which is a thick viscous substance that allows us to maintain the eye while we manipulate the inner tissues. A larger incision called the phacoemulsification portal is created with an instrument called the keratome, and it's through this incision that we're able to introduce different micro-instruments. The first instrument that you're seeing is creating a small nick in the envelope that surrounds the cataract. This envelope is called the lens capsule, and this part of the procedure is the most critical for successful phacoemulsification, as creation of a nice circular opening lends strength to the capsule during the cataract removal. Additionally, a correctly proportioned capsulorhexis will serve to support the intraocular lens implant in the appropriate position so that the lens power is effective in correcting the patient's vision. We're now using a small cannula and injecting saline solution into the substance of the cataract. And what this is doing is softening the cataract, and it's also delineating the different layers of the cataract. The inner layer is the nucleus, and the nucleus is firm and requires ultrasound energy to break it up. What you're seeing is the phacoemulsification handpiece being introduced, and a central score is being placed through the nucleus. There's a second instrument in the eye that is helping to support the nucleus and keep it steady. After the nucleus is scored, it's then broken into half nuclei or heminuclei, and each half is engaged with the phacoemulsification handpiece and gently broken into pieces. These pieces are suspended in the balanced saline solution that is being irrigated into the eye, and this emulsant is subsequently evacuated from the eye. The next layer, moving inside from out of the cataract, is the epinuclear plate. And here you see the phacoemulsification handpiece engaging this thick plate and finally able to grasp and remove it from the eye. Upon removal of the outer plate, you'll notice many feathery, wavy fibers remaining in the periphery of the pupil. These fibers represent the outer, less dense cortical material of the cataract, and we use a different instrument to remove these fibers. This is a very low energy vacuum called an irrigation aspiration handpiece, and by using this instrument we're able to gently remove the final pieces of the cataract from the capsule leaving essentially an empty bag. Uh, this bag serves as the supporting mechanism for the patient's new lens or implant. It's important to try to remove as much of the remaining cortical fibers, as leaving some of these fibers in can lead to a proliferation of cells later on in the patient's life, and this can cause what's known as a secondary cataract. Secondary cataract can develop and actually affect the patient's vision adversely. However, this is easily remedied with a laser treatment. What you're seeing here is just fine vacuuming of the capsular bag, trying to get these few remaining fibers. After the capsular bag has been cleaned, another injection of the thick viscoelastic is utilized. In this instance, you're seeing the surgeon place a micro squeegee in the eye to clean the capsular bag to an even greater extent in an attempt to maximize the patient's visual performance. Now the viscoelastic is being injected into the eye and filling the bag. Now this dial that's being placed on the eye helps the surgeon determine the correct orientation of the astigmatism correcting lenses known as the toric lens. This patient is elected to have their vision optimized and their astigmatism fixed at the same time as their cataract with the astigmatism correcting lens. The lens is made of a soft acrylic, so it is folded and we're able to inject it through the very tiny incision. Once the lens has been injected into the eye, you'll notice that it unfolds slowly like a butterfly, and in this instance I'm just helping it unfold. Now what may not be apparent are there's little marks in the periphery of this new implant, and these marks are aligned with the marks which we painted on the surface of the eye. And by aligning the two sets of marks, we're able to neutralize the patient's astigmatism to optimize their vision. And here we see a well-placed implant. Now I'm gently removing any remaining viscoelastic substance and filling the eye with physiologic balanced saline solution. Care is taken during this step not to move the lens out of alignment, as even a slight movement will result in a loss of the astigmatism correcting effect. A little bit of fluid is injected near the incisions. The eye is filled to physiologic depth, and the wound is tested and found to be watertight. And that completes the case.